All right, well, I just wanted to shoot a video. I may start trying to do this. I mean, why not shoot videos like this? But I got to thinking while I was out here paddleboarding around Lake and Oak Mountain, I kind of come out here to unplug, get away from the noise a little bit. And I was talking with a patient today before I came out here. He's in the medical field, and he's been dealing with a chronic pain kind of issue, more than an issue, kind of a life-altering scenario for the past, I think, almost 5 years. And he's being in the medical field, and he's gone to every local physician that deals with everything from neurosurgery to endocrinology. He's went to Mayo Clinic. He's been seeing me along the way as kind of a voice, another person to talk to. But he's also read a ton, educated himself, and he's kind of, instead of that Sisyphus kind of pushing the boulder up the mountain and having it roll back on him all the time, even though he's not out of pain, kind of the conversations when he's in the office now lead more towards, well, if I'm going to deal with this stuff, I'm almost like he's going to take a David Goggins-esque. I'm not saying you can just like run through stress fractures and run through chronic pain like the Kool-Aid man. What I'm saying is he's kind of over the mountain of like trying to pathologize himself. And we had to have the conversation today, like, something could have went wrong. Like, I think there may have been a possibility of a mini stroke or maybe mini strokes. But then he's had the diagnosis of like small nerve neuropathy, all these kind of things. But he's just kind of at the point where he's like, well, I have to kind of realize that my input, my afference and interoception is just off for whatever reason. He goes, The Way Out was the book that he was telling me to read. He goes, this book is basically talking about how people with chronic pain are having to understand that their body's calibration system, their integration system is off for some reason, and that their inputs don't match their output of pain. Pain is an output, it's not an input. But that just kind of got me thinking of like, what could be the causes for that? And this is, a lot of, it's a conjecture and just, thought processes of, well, there's a lot of just, like I'm still out here in the middle of a lake. I can hear a guy mowing his lawn. I have a GPS watch on. I'm talking to my phone right now. So there's still a lot of static. So there's still a lot of unnatural things in our environment. And it goes maybe not so far, maybe so simplistic as, the foods that we eat, the chemicals that are in our soil, our water, even, a natural lake like this, to the things we put on our skin, the lights in our homes, all these things, the air quality, they're not the same as they were even when I was small, so 3 decades ago, let alone like 60 years ago. And that's going to have ramifications on interoception, which is basically feedback from inside of your body, organs, tissue, muscles. And interoception kind of rules the roost of how you feel overall, right? It's going to kind of determine what's your status quo. And if your interoception's off, there's a high likelihood that pain, which is a normal protective signal, it doesn't mean that something's hurt. It may mean that something's going to get hurt, that you've had a similar incidents. Like, let's say I've had a run-in with a shark before, maybe, being on a paddleboard, even on a lake, knowing that there's no sharks, logically, I still may have a higher, higher sense of anxiety just because I've been in that scenario before. I just kind of thought, well, what do you do in the face of that? You just, try to go off the grid, unplug, eat, grow your own food. For some people that's realistic. For most people it's not. But you try to limit the noise as much as you can. And that would be doing what? Doing things like this, getting outside, exercising, de-stressing your system, trying to get good sources of water and food, good sleep, removing interference in terms of relationships, people that are around you, whether that's family, friends that may be creating more stress and anxiety than needed. If you can remove yourself from that scenario. I realize, sometimes immediate family stresses out. You can't really just like check them in or check them out. But if you can't change the amount of stressors coming in. What you can do is try to make your system more robust. But I think that also comes down to a lot of same things. If I'm healthier overall, how do I get healthy? Based on what I eat, drink, do, how I sleep, who I hang out with. So you know, by limiting the stressors, you're also making yourself more robust. So it's kind of a 1-2 punch in that term. So just kind of the thought of the day on what's becoming, I don't think it's becoming, I think it is an epidemic, but in doing research for the upcoming book, plug Age of Movement, coming out December 31st, you know, chronic pain in the youth population, we're talking kids under as young or younger than 10 years old, is becoming very prevalent. And there's a whole plethora of ideas of why that's the case. But, you know, I just having a little girl that's on her way to, she's only 1.5, she's not 2 years old yet. I don't want to freak my wife out. It just makes me think, you know, what can I do to help her? How can I live my life to set an example? So, yeah, that's my thoughts for the day. See ya.